So I'll get started. Actually wanted to, so today's a little bit more informal than our usual academy sessions, because we want to, just take time to really reflect on the fact that, you've come through the academies and definitely still into the implementation portion or getting started the implementation, but we wanted to hear your reflections. So we don't always do this, but we have time today to just kind of, if each person can just share your name and your organization and your role. And I'll just call on each person as we go across the screen. So you know me, Huda, consultant First Five. And how about you? We'll go to Sejal.
Hi, Sejal Shah, First Five consultant.
Thank you. And Deborah.
Deborah Mathias, First Five consultant.
Great. Erwin.
Good morning, Erwin Cox, program officer at First Five.
Great. And we'll hear from Erwin a little bit more soon. Riva.
Hi, good morning. Reva Vero, Clinic Director at Ultimate.
Thanks, Riva. Ashley.
Good morning, Ashley Woods, Program Manager Senior with Cal Optima Health in the Contracting Department.
Thanks, Ashley. Carmen.
Hi, everyone. Carmen Katzroff, Executive Director at Cal Optima Health.
Thank you. And Nguyen Lu?
Hello, everyone. I'm Nguyen Lu from VM Medical Group, Dr. Talvo office.
Thanks, Nguyen. Tien?
Yeah.
Oh, I think mute.
Muted.
Maybe frozen?
Really?
Oh.
That's okay.
Oh, there you go. You got it.
So I'm Tien Vo from VM Medical Group with Dr. Vo.
Good.
Thank you, Tien. Welcome. The names are moving around on my screen here.
I know.
Jaylene.
Hi, good morning, everybody. Jaylene Valadez. I'm a grants manager here at Ultimate Health Services.
Good.
Welcome, Jaylene. Kevin.
Good morning, Kevin Evelani with Choice Health Network, CEO.
Nice to have you, Kevin. Miguel.
Good morning, Hoda. I'm just finishing up another meeting. It's Miguel from Choice Health Network.
Nice to hear your voice, Miguel. Jocelyn. You're off mute, but we can't hear you. No, we still can't hear you. Maybe try to log back in. Yeah. Okay. We'll keep going, but when you get your sound back, come back to us.
Yeah.
JL Maya, I don't recognize your name. It's not me. Okay, let's go to Rosana.
I don't know what if we're having audio problems on our end.
Yeah.
Because Rosanna,
Can't hear you either. Phone on Do Not Disturb. I don't know if it's my phone messing with the connection. Okay, let's try Eileen. It's so interesting.
Good morning. Eileen Rodriguez of Choice Health Network.
Nice to meet you. Welcome. Okay, that's so interesting. I don't know why we didn't sound from a few people. But okay, well, I think we can get started, and hopefully as the meeting goes along, we'll be able to hear you, because we want to be able to hear your voices. So thanks everyone for joining. This is the agenda for today. And we're just going to go over a couple things and then really just spend some time to reflect a little bit and then leave plenty of time for you to ask questions that are coming up for you before we wrap up today. So I want to ask Deborah to share about the performance metrics.
Yeah. So little by little, I notice everybody's starting to submit their performance metrics. Thank you. I appreciate it. You want to just go to the next slide?
Yeah. There you go.
So we're looking at, performance metrics, as you know, from two perspectives. First one is the well child visits. You submitted baseline data, and that allows us kind of to evaluate improvement over time. So, the number of active children in the practice, then it's an Excel spreadsheet. So we put in the expected number of visits, and then, we project them and your actual. So we're really looking kind of for your rate of well child visits. I think most of you are accustomed to seeing these kinds of numbers through HEDIS, et cetera. So anyway, I have not heard of anybody have any difficulty, and I really appreciate that you guys are doing this. So your first quarter is due, actually by June 15th. So, the sooner you can get that information in. So it'll be the quarter of, this is January to March up there. I noticed that most of you are doing April through June, April, May, June. Yeah. So anyway, I think if you could focus on doing that first quarter, January through March, that would be helpful. It'll be your first quarter that you fully implemented your Healthy Steps program. And then next page. This is hard to see, I apologize, but if you look at that left-hand column, again, it's all of the metrics that you need to input, and then, the definition units measure screenings, referrals. As you know, later in the metrics is asked.
We're going to go Layla. We're going to reach out to Jillian. We're going to reach out to Dr. Patel.
Lewis, yeah, you need to mute. Thank you. And then anyway, later on in the metrics, you do report the number of dyadic claims that you had, and then your profitability, your revenue versus your expenses for the program. So we're obviously looking for sustainability. And again, our goal is to help you reach sustainability by the end of the grant. So anyway, that's it. Performance metrics. Like I said, I'm starting to see everybody input them, and I appreciate that.
Thanks, Deborah. And you have Jeanette Medrano's contact at First 5 Orange County if you're having issues with the platform, but you can also reach out to Deborah or I, Sejal, if you need help with that. Thanks, Deborah.
You're welcome.
Okay, so we're going to move through. And then next thing we wanted to share is I wanted to introduce Erwin at First 5 Orange County, who he does a lot of amazing work with community engagement. And we want to share a little bit about a project that First 5 has been working on for a few years, and something we'd like to propose to you, and also hear your feedback on as to how this project Kid Builders might be of benefit to your patients or even your own team as you work with families and talk about early childhood development. So Erwin, would you like to?
Yeah, thank you, Hoda and Deborah, for inviting me, for providing some space to talk to the academy and to the clinics. My name is Erwin Cox. Again, I am the Senior Program Officer for Family and Community Engagement here at First 5 OC. And I also oversee Kid Builders, which, I'd like to share a little more with you. I'd like to start with a little bit of the background. And so is it okay if can I share my screen? I just wanted to show people like how we came up with Kid Builders. Some of you may be familiar with Kid Builders, might have heard about it, might have utilized it in the past. Kid Builders was created by First 5 about 20 years ago, I want to say. I've been with First 5 a year and a few months. When I came on board, they had just relaunched Kid Builders. In the past, we had some big binders that we would provide families with all the activities, all the domains, all the information to use at home. But these days with climate change and trying to be more eco-friendly, we went digital with Kid Builders, and so we relaunched it last year. Like I said, I'd like to start a little bit with how we came up with Kid Builders. And we kind of put together an ad hoc group of experts in early childhood, education, mental health, and but we basically went to the CDC, and I'm sharing my screen here for you all to see the developmental milestones that the CDC has for kids 0 to 5, right? They have it here in the first year. They have it broken down by every 2 months, and then they propose the milestones. Then after a year, they break it down by 3 months, and then after 2 year by every 6 months, and then every year. But let's just click on 1 year for kids 1 year old. And if you click on any of those ages, you will see that there's 4 main areas of development that the CDC is looking at. One is the social and emotional milestones, the language and communication milestones, the cognitive milestones, learning, thinking, problem solving, and the movement or physical development milestones. And for each one, they will recommend what the child should be doing at that age. So we're here on the 1 year. So for social and emotional milestones, at 1 year old, kids should be playing games with their parents or caregiver, like pat a cake. That's just one example, right? On language, they should be waving their hands bye-bye, calling a parent, mom, mama, dada, starting to have those words, and they should start understanding no, right? And you can see that when they pause briefly or they stop when you say it, and so on. You will find milestones for all those 4 areas of development. That was 1 year old. Let's see if we go to 2 years old. Then here again, social and emotional milestones. Noticing when others are hurt or upset. They have language milestones, cognitive milestones, and movement, physical milestones. So those 4 milestones are always present for every age, 0 through 5, to track the child development. So with that as a baseline and as a guideline, we created Kid Builders. And well, actually, let me just, in case you want to explore a little more, let me put the link for the CDC milestones in the chat. You can check on your own and go explore the milestones for each age group. And then let me put the link for Kid Builders here. And just quickly, do you see the Kid Builders page now? Did my screen change? Or
Yeah.
Kid Builders. Okay, great. So Kid Builders is an easy way to help kids grow in 6 areas: the mind, and we have here the mind, the words, the body, the relationships. So these are the 4 CDC areas, and we added safety and health. So the mind would be in CDC talk, it would be the social and emotional milestones, or language and communication. I'm sorry. Words with language. Sorry. Body will be the physical movement and physical development. Relationships would be the social and emotional. And then we added safety and health, which, to be fully honest, those are a little more geared toward the caregiver, some advice and some recommendations on what to do for safety and health. So we have 6 domains for Kid Builders, and we divided it in 1 year age group. So we have babies, we have 1 year old, we have 2 years, 3 years, and then we compile together the 4 and 5 years in one area. So similar to the CDC, for each age, we have activities, right? And so you're on the website, you have some activities. Click on the activities, and then it will take you to all the domains, right? And so we have mind builders. We can see the activities: baby builders, body builders, safety builders, word builders, relationships and health, So if we click on the icon, then it will take us to all the activities that people can do, parents, caregivers can do with the kids. So for mind builders, the first activity recommended is Little Dropper, and you have the title of the activity. You have here a couple bullet points telling you what it's helping the kid develop. Like baby learns that they can make things happen, action reaction, and they start pre-measuring and pre-counting skills like the 1, 2. So they start learning those things. Then it explains how to do the activity and some prompts on what you can say to the baby as you are doing the activity, like you threw the red ball, and so they will start associating red, maybe hopefully with the color at some point, right? Where is the ball? Oh, here it is. Those things that a lot of parents, caregivers, we do it naturally with when we're playing with our children. Here, we're just putting it together and putting it in categories so people know how they are helping their kids develop, right? The other activity is listen up. Again, bullet point on telling you what it's helping with, what skill it's helping develop, how to do the activity, and some prompts on how to interact with the child while doing the activity, right? In general, all those activities will help develop relationships, and that's how we can increase the kids' abilities and development just by combining domains in one activity. Time to count is another one. Look, baby, look. And they all have the same structure. The title, what milestones it helps, how to do activity, and some prompts on what to do and what to say. And so on. You go to bodybuilders, same thing. Activity, milestones, and skills, how to do it, and recommendations or prompts. And you have a list of 5 to 6 activities per domain, per age group, and so on. If you go to safety builders, it will be the same. Word builders, it will be the same structure. And again, like I said, baby, 1 year, 2 years, 3 years, and 4 and 5 years. So a parent, a caregiver will have plenty of activities to do with their child. And as they grow, they will have more activities to do with them. Something that I wanted to point out quickly is at the top right corner of the website, you can select the language that you want the website to be on. Like if I wanted it in Italian, I go here, Spanish, and so on. So we have it in I want to say 10 languages for people to choose. And this is what we've been promoting for the past 2 years in different ways. We promote it at resource fairs, at outreach events. We organize our own builders events. And we are looking for different ways to bring this resource out to parents, to caregivers, because they are, if you see, it's mostly activities that people can do pretty much anywhere and with whatever they have. They don't need to buy any special toys or tools to do these activities, right? People don't need to sign up for anything. They don't need to register for any program. They don't need to take their kids anywhere to do these activities. They can do them wherever they go, where they are. And like I said, today, what we are bringing to you is a proposal, request, an opportunity. I will stop sharing the screen here so we can see the other image that I had, but I wanted to pause and see if there's any questions, any comments, or anything else.
Erwin, I do think it's, if everybody, I'm not sure, it took me a while to track all this down, but in the comments is the link to First 5 Orange County Kid Builders. And you can do this on your phone. It's just, I tried it in my car actually. And I just clicked on the link and then I clicked on it, and you literally could do this on your phone with a parent they can, and I think the QR code takes you there too, doesn't it?
Yes, yeah. Would you all mind sharing the screen with the slide with the poster that we created?
Sure.
And so we can there we'll be able to see the QR code. I'm not sure if it's big enough in your screen to scan that QR code, but so what we have here today is, like I said, we wanted to talk to you all, offer this, and see if you would be interested to have this for your clinic. We developed this. This is a poster. It's 12 by 18, so it's a little bigger. I want to say the size of letter paper, 1.5 letter size, a little bigger than legal paper. So 12 by 18. It's a little thick, like half an inch thick, but super lightweight, the poster that we created. So the idea is, again, to offer this to people at any moment where they can do it whenever, wherever they are. So we created this poster that, has the basic information, an example of an activity. In this case, we picked Follow the Leader, is one of the activities proposed for 2 or 3-year-olds, I want to say, and a little prompt or a little something to engage people at the bottom, just saying, play together anytime, anywhere, and help your child develop there. And then we list the domains that Kid Builders is divided in. So the minds, the body, the words, the relationships, the safety, and the health. And the dad is kind of saying, hey, scan for more Kid Builders activities, right? And so people would just scan this and have that on their phone ready to go. And if they're like, say, for example, they have a doctor's appointment and they're in the waiting room and they have a few minutes to wait, they can explore with their child, they can explore Kid Builders while waiting. Many times, parents give kids their phones to, have them sit still or calm down and wait. So they could, instead of just playing YouTube or something else, they could be doing Kid Builders together, and they can keep it for later whenever they would want to use it. So again, yeah, we have this. We are able to print the posters. We actually already requested to print a few of these. And today we're asking if any of the clinics, I think I saw something in the chat, someone being interested, but if some of these clinics that have the Healthy Steps program and a specialist would like to have this poster on their clinics for people to use as an extra resource, something easy for parents to do with their kids, age appropriate, playtime, and that way they can also be learning and developing. And now pause again.
I think the nice part I learned is it's really easy to use. And you may want to, you're trying to talk to a parent about, well, try to get your child to step up, hop up. You can show them that, on here if they're 2 years old. This is the things you want to see developmentally. And a lot of times it's the Healthy Step specialist or the provider, the pediatrician, nurse practitioner that picks up that there's maybe a concern.
Yeah, and these can be paired to, say, for example, the child goes for a developmental screening, and the pediatrician recommends that this child could use a boost in their fine motor skills. Then we go to bodybuilders, and then we'll find activities to do with them to develop their fine motor skills. Or they say, he would, benefit from some improvement in their language development. And we go to word builders, depending on their age, we'll find activities. And like I said, most of the time, one activity will actually help in different areas, but we needed to put it in a bucket. So that's why we said, well, this activity helps. The main support is in this area. And then it also helps in other areas in different indirectly, but this is the main benefit of this activity. That's why we put it in one category. But most of them, like I said, most of them will help with relationships, because the idea is to do these activities parent-child or caregiver and child. And then one activity will help with a couple of, we have coloring books that we help, that we give away, and We have pages where the kids just color and practice their fine motor skills, but we have blank pages where they can do whatever they want, and so that's helping their minds as well. But yeah, just open to see if there's any comments or questions regarding this, and see if anyone, I see at least one clinic is interested, and see if any others are interested. We can start testing it out. We just developed it in English, but down the road, if we see the need, we could translate these into different languages depending on the clinic and the need. So this is kind of like a pilot, if you'd like, or a test run, and then we can see what we can do down the road, depending on the need.
Thanks, Erwin. And I know Dr. Q just joined. Welcome, Dr. Q. Erwin's sharing about the Kid Builders website that has activities that are developmentally appropriate for age. But what he pointed out that when you go to this QR code from your phone and you go to the website, you can actually adjust the language right now. So I think the languages spoken by our communities are represented on the website. So yeah, we'd just love to hear your thoughts about what any clinics that any thank you, Choice, for stepping up. Are any other clinics interested in exploring putting this either in your waiting room or in one of your peds exam rooms for parents to browse while they're waiting, or even for a clinician to pull up if needing to talk about a certain domain in development? And I think yes,
I have reviewed it already. When you sent the link, among the link last time,
great.
I'm reviewing the Vietnamese materials,
awesome.
and I find them very useful.
Okay, that's
I'll
great.
let you know further later.
Okay, that's great feedback. I think thank you. That's great. So if for any of the clinics that choose to post the poster, even just anecdotal feedback about if you notice families doing different activities in the waiting room or in the exam room because they're using it, or if it's helpful for clinicians, that type of feedback would be really helpful for us. Okay, great, Dr. Min. Thank you, Chuck, as well. Awesome. Okay,
we can follow up with an email, and we'll send you the poster and the link. And you can, I think once you check it out yourself, it's much easier, and then maybe communicate with Erin what you would like. But it's kind of fun. I was sort of surprised. So I think once you do it and see how effective it can be, you can make a decision then.
And we'll follow up during the post academy when I meet with the Healthy Step specialist, which I'll talk about in a moment, on feedback in a few months to see how it's going, to hear what Healthy Step specialists are observing with this. Awesome. Thank you so much, Erwin. Great work on this. It's such a great asset for Orange County.
Thank you, and thanks everyone for the space again. Hope to hear from you all soon, and yeah, I'll follow up with you, Hoda and Deborah, on to see how to coordinate dropping off at the clinics for those who are interested.
No problem.
Perfect. Thank you so much. You'll have a good day.
You too.
Thank you.
Okay, great. Thank you, everyone. Okay, so moving right along here, today is a celebration because you have all dedicated so much time to just this grant and implementation, with all the many steps of implementing Healthy Steps and attending the Academy session. So we really, really, appreciate all of your time and dedication to this. We know it's a lot of work. And so while this is the last Academy session, it's really, we want to wrap up and hear your reflections, as well as address any questions that have come up over the course of this period, and then just kind of give you a little bit of insight of what does it mean for the Academy to end, and now entering into the post Academy, how does that change? And so I just this is the screenshot from our website, which I know it's small for you to read, but it's on the Healthy Steps page that's on First Five's website. And, the Academy sessions were more of these structured, recorded sessions to help you get going. And like I said, there's one more left, but it's really just for the Healthy Steps specialists. So I think of the post academy more as like the maintenance phase where you're still either in the process of getting trained and getting going, or just getting started with actually implementing. So the post academy is really to provide continued support. We won't have these academy sessions anymore, but we'll definitely still be having touch points to meet with you. So Deborah will be meeting with you regularly, to just review performance metrics and see how things are going. And then I will be meeting with the Healthy Steps specialists as a group, and we'd like to meet once a month so that they can sort of learn from each other and share aha moments and resources they've discovered, or just see how it's going for each other and learn from each other's experiences. When we did that with our 5 pilot sites before the academy, it was really powerful for the Healthy Steps specialists to kind of learn from each other. So I'll be reaching out to pull the Healthy Steps specialists on what would be a good time to meet monthly. I have topics set, but that's flexible. We want to base it on the needs of the Healthy Steps specialist. So we'll be continuing to engage that way. And there is one thing that that I'd like to request by August, and that is, I'm sorry, I can't zoom my screen, but I think on your end, you all can zoom in. We've highlighted when we want when the performance metrics will be due, but in August, I would just love if clinics could submit just one screening workflow that they've begun to implement and are using, just to kind of see how the screenings are being incorporated into your processes. And so in August, if you can just email that to me, that would be great. And if you're needing assistance with that, or anything else, you're always welcome to reach out. So yeah, like I said, this is more of like a TA component, the post academy, just to make sure you're all comfortable with continuing to implement the model. And in the meantime, we're assuming that, so that's kind of the green column is what your engagement with first 5, and then you most likely still have TA calls that you'll be completing with Healthy Steps National or 0 to 3. And so we've kind of listed them all here on the left-hand column, and those are for you to schedule with Healthy Steps or 0 to 3, based on what your schedule is. But those are all specifically about topics that will support you in that implementation. So you'll be doing that as well. So that's what the post academy looks like. And as always, you're always welcome to reach out to us. So are there any questions about
Hoda,
academy to
this
post?
is Gwen again.
Hi, Dr. Kish.
I am really impressed by the additional enrichment that Orange County has performed. And I see that the handouts and now the flyers regarding the activities, I see that there is a treasure of additional resources to us. I am a little bit concerned about compiling a list of the resources for the family to take advantage of or to use to support them once they embark on that journey to improve a child who may have, like some social lags or language or things like that. So then please continue to help and offering Orange County specific resources and work with us on that. Don't stop here.
Yes, oh, for sure. I'm so glad. Thank you so much. You are the ones doing the amazing work on the ground and working with patients. So just very impressed by all of the clinics that are participating. We definitely want to support you because as part of the Healthy Steps model, you need to have a resource guide that I think Healthy Steps wants to see. So her first 5 is definitely here to support you with finding the resources, to compile your resource guides. And in September, it would have been Academy 5, but we moved it to September so that the school districts can participate, because there's a lot of resources in the school districts for 0 to 5, and we want them to engage. So we're setting up, actually Erwin is helping us for early September to set up, and the date and location are still to be determined, but a resource fair, which will be where your Healthy Steps specialists can come and actually meet people that represent resources in the community, like the regional center, like your local school district, so that you can develop a face-to-face relationship with them. And so when you're referring patients or needing to consult about a patient, you've already met and you already know each other. And so regional center is one example in the school districts, but there's several that the First Five has been thinking about, and we want to invite everybody to be in the same room and build those relationships. So we hope that helps with with the referral process and sharing resources and handing off families to resources that can help them. So thanks for bringing that up. It's definitely on our radar.
It's not only besides the school district though, and
Yes.
the purpose of First Five is to reach the children as early as possible, as soon as they show sign of not being able to perform some of the early milestones. So, for example, there are parents at home that are lost as to how should I play with my child, and the child obviously is showing that could benefit from some social interaction. So I used to go to the First Five and look up all those places, that there's a little map with all those places that they could go and the times and so on, and then come with the child so that they can benefit of interacting with other parents as well, and so on. But that some of those places change. So I'm looking for updates, because the worst thing is after they persuade themselves and we persuade them to do it, then they find that it has been moved and it's no longer like that. So you have to be updating it, and we need help.
Absolutely. I love that you're bringing this up. Yeah, exactly. I think you might be referring to Learning Links. So yes, First Five does have an update, and I think it's really powerful for the Healthy Step specialists to see what those centers look like that provide that kind of support for parents to learn how to play with their kids, and it's all free and parents can stay with their kids. So they have that updated resource, and then there's a lot more. Probably since the last time you checked in, there's a lot more happening with home visiting, and there's a lot more happening with community-based classes that are for pregnant and postpartum families. So really trying to catch families as early as possible to get them to attract their interest in engaging with communities resources where they're not isolated, but they're also learning a lot of these skills and being able to be around people who can help them catch areas of need and support them. So yeah, those are the types of research. And like you said, to your point, starting much earlier than when child reaches school age. So those are the types of examples of resources that we want to connect the Healthy Step specialists with. Yeah. Thank you for your advocacy. Okay, thank you. Okay, so we're kind of in reflective mode a little bit, and we just wanted to go further together in reflective mode and think about this. You were all excited to receive this grant, and we told you it was a lot of work, and now you know how much work it really was. But just in this process, as you think about building your teams and transforming your clinics and taking in a lot of information and learning how to provide services that are now billable to families, there are probably many silver linings to all of the hard work, which we think of as the roses, but then there's probably a lot of thorns, and we want to hear about all of it. So this is really an opportunity for you to come off mute or enter in the chat sort of any reflections that you have personally or that you've heard from your team, especially if you have team members that are on the call, but you want to surface things that you've heard, so that we can make this process better for clinics if we do this in the future, but also just in general. We've always been walking alongside in order to learn from you. So just kind of wanted to share some space to hear your reflections, recommendations, trouble points, pain points.
Don't be shy. It's okay.
Yeah, exactly.
We're pretty used to criticism.
Yeah, bring it on.
Okay.
Well, I have something if it's okay. I don't have a criticism. I actually, mine's more about organization. I think that learning how to manage the social piece of this, the workflow piece of this, and the billing piece all together has been, I won't lie, that has been a little bit more difficult. And so we're getting there. I actually feel like really, really good today and like last week and different things. But I think that might be, if we could have seen maybe a graph of here, 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 and I know we did. So here's the thing, we did see stuff, but maybe a simpler big picture view and then break it down. So like a simple big picture and then break down each one of those umbrellas. That might have helped me understand the big picture sooner. Because I think I was a little slow on that, to be very honest. But otherwise, I feel good. I feel like great today. So I don't have any fatigue, just knowing how my brain works. And I'm not sure if anyone else thought that way. But I thought everything it's good. I enjoyed the learning portion of when we have speakers too very much. So thank you.
Carrie, have you seen the last time I think we met, we shared like these 4 pillars of activity.
Yes.
Concurrent activity. Did that help?
Yes, definitely. I think once I got all the pieces put together, I feel very confident today.
Okay.
I think in the very beginning,
Okay.
behind, I wish I understood that a little more clearly in the beginning. Today, no, I feel like we're good. Yeah, that was my only thing. So it was like more than halfway in, then it clicked for me. I went, oh, got it. And that I wish I had gotten quicker. And that could just be me. I mean, no one else.
You're right. It takes a while to really comprehend how many different activities are happening. And
Yes.
2 with 3 different organizations.
Yes.
The 3 first 5, and then also we have CalOptima contracting. So this took me a while to figure that out too. So yeah, it's definitely great feedback.
Okay.
Carrie, we developed that just a couple months ago. It hit us. I thought, nobody realizes these are all concurrent activities.
Yes.
And we should have presented that at the front end so that you would have said, oh, I jokingly said, should we make it a poster? It's one of those situations like, how does this all fit together? And then the other thing is, I think when you're making changes to your practice, that's a big thing. It changes your workflows from the front end to the back end, EMR, building coding, and that's a big part that we don't really dive into. And we should talk to you about that. Yeah.
Yeah, definitely. Yeah. We definitely met this morning about that before this meeting. So we're definitely on it. I feel like I hope, I'm going to speak for our team. I feel like we're getting it and we feel really in it. And I think we're really invested and committed, which we haven't from the beginning, but I feel like we all are just taking big bites and doing what we have to do. So I feel good about it. So thank you. Thank you for supporting us in this.
You're welcome.
At the back end also, the practice will have all these steps, because it's just knowing that you need to do this is very different than actually implementing it and embedding into your practice that on an everyday workflow, this needs to happen in terms of the care, in terms of the billing, in terms of scheduling, in terms of referral. All of those tracks are also there. So it would be a great way to kind of, let us know how that goes. Because that sorting also is another big area that I don't think we have talked, but it's there.
Yeah, it's definitely there. Yes, thank you. Yeah, we will keep you posted as we're going through this. Definitely. Thank you.
Chắc Quỳnh phải làm giấy tờ để mà Quỳnh linh vị anh quá. Anh không bao giờ Quỳnh đã nói no.
Dr. Q, you're saying something, but I don't think it's
No, don't ignore that. I'm trying to do another thing at the same time. So ignore that.
Oh my gosh, you don't need light in here now.
Okay. I think for those who've begun to implement or provide some services I know many are still in training process, but for those who've begun to provide some services, what have you noticed in terms of like, it takes so long to get to this point, but benefits to the family, benefits to the clinic day, by having this model in place, and maybe the best part about that or the hardest part about that? Oh, go ahead, Dr. Min.
Yes, I think a maybe said a little bit about this before. We're coming from a little bit of a different place because we have an existing integrated behavioral health team. So one of the things at least we've noticed for the clinics that we're a part of, but also for the clinicians, is just kind of the change in the model. So it's strange to go in without a suspected mental health diagnosis, interacting most with littles, which they're not used to, not having to do, say, assessments for suicide, for things like that, at least for the patients. So that's been and continues to be a bit of a challenge, and trying to get our team used to that, and then also just kind of the clinic used to the fact that we're not in there that long as we used to be, which is actually a good thing, I think, because a lot of things they've told us before is, oh, you guys take so long, families can't stay. So having the flexibility of the 15-minute codes and being able to bill for that time has been really great. So I think over time it will be a lot better. One of the challenges also has been trying to integrate, because we are separated with our social workers in the clinic. Social work has traditionally been more resource-based and also has taken on more of the maternal depression piece. So integrating everyone, psychologists and social work, all into that under one umbrella of Healthy Steps, because social work reports through a different line. That's been something, it's gone well, I would say. So that's been something. One comment that I'll make regarding maybe perhaps moving forward is that there is so much information out there, and it seems like everyone is doing their own thing in terms of developing their own set of information and resources and things like that. For example, the Healthy Steps organization has their own stuff. They have a sustainability meeting that they put on a monthly basis. UCSF and Kate Margolis has a bunch of stuff that they've put together through ACEs, I think, or the ACEs grant. And then one thing I'll say that you guys have done, which is great, is putting together Orange County specific resources, and obviously with CalOptima and things like that. So that is something that I haven't been able to get elsewhere. So I would definitely encourage this kind of thing in the future, and providing more Orange County specific resources, also with our managed care entities, yeah, and all those things as well. And I know that there have been some questions out there still that we don't quite know the answer about, like, with a limited number of units for a few of the Dyadic codes, what does that mean? So I know things are changing, but yeah, I just wanted to say that I appreciated a lot of the Orange County specific things that you guys have done.
Awesome. Thank you so much for those reflections. Well noted, and recommendations. So we can, thank you. We can open it up to also include questions, because I know we only have 10 minutes left. So if you have, as you continue to think about the roses and the thorns, but also any questions, we do have Carmen and Ashley who are here on the call with us today. I am really sitting with Dr. Mendez, your comment about also the, the shift from addressing problems to sitting with well families and addressing things before they become problems, or even just spending time focusing on the wellness, and that's an amazing shift, and I'm excited to see how it continues to evolve for your teams. And thank you for the recommendations you shared as well. But we'll open it to questions as well. In these final 10 minutes, I'll actually stop sharing, even though I'm loving those roses, but even the thorns are beautiful, actually. There's beauty in thorns sometimes. All right. Go ahead, Chris.
Yeah, I kind of related to the comment that I made. Was wondering if there was any clarification from the state or DHCS regarding the 24 units per year for those codes. If that, I think there was some discussion around, does that mean 24 visits, or does that mean 24 individual codes, which would be a severe restriction on the amount of services that we would be able to provide? So any clarification on that?
So Carmen or Ashley, that'd be one of you guys. We've received the March update on the non-specialty mental health services to Dyadic care. And they said, the DBH well child visit is 2 a year. And then the specific codes like H215, they all had limitations and it said 24. And my understanding it was 24 units, not 24 visits. And that's the clarification he's asking for.
I believe that's correct, but I think, Deb, what would be great just to make sure, what I like to do always is internal and do double checking, right? So I think the one of the best things will be, and ongoing too, as you're going into the, more consultative phase of this after the academy. Yeah, I mean, maybe we can gather up any formal questions. That way I don't misspeak in bringing them back in. I do believe that is the case with the 24 units, but again, let me verify that internally. So if we can just get questions back to me in writing, that will be great so that I don't misspeak.
No, that's fine. And like I said, it's, 24 visits is, 2 a month versus 24 units at 15 minutes.
Yeah, I don't think it makes sense. I mean, 24, yeah. So I believe it's the units, but again, let's get the 100% clarification on that.
Okay. And it'll be on those 4 codes, the Dyadic codes. I can send that to you.
Perfect.
What else? It's almost the weekend.
So I was anticipating more questions around billing. So does that mean it's going fairly smoothly for those who are doing it?
I think we're definitely in it and we're trying and we're working on it. So we're actively engaging in it with our teams and asking questions. I mean, and reaching out and rereading. So I feel like we're in it. So would I say it's perfect and we have it all worked out? No. But we're definitely in it and moving right along. I feel like we've taken a really good grasp of this building piece.
That's really good.
That's great to hear. Sounds like you have what you need. How about for others? Rosanna, how's it going with families together?
Can't hear her. Yeah, it's unfortunate.
Sorry, I don't know if it's my Zoom today or what, but feel free to put it in the chat. I'm curious how things are going for you.
I also wanted to ask VM team because, being a private practice, how has that been? So Lou or Twain, you might have some feedback or questions.
It has been challenging because what was expressed, all of this has to happen at the same time. And so trying one type of workflow and then modifying it and so on, it has been challenging at best. And then you look at the next step and then you say, oh, and when we were doing the implementation plan, we have to project ahead and also like the type of information that we need to gather to make sure that that information is going to be acted on, then what goes to the Healthy Step specialist and what needs to be addressed and the action points and so on and so forth. It has been challenging, but like everybody say, we're on it. And it's because we're on it that we are appropriately concerned about certain areas where we would love to get the guidance or the whatever enrichment along the way that First Five can provide. And we would be the first one to be able to give you a feedback of how it changes or how it makes us more effective.
That's great. And we're definitely available to continue just one-on-one support with your specific needs for your clinic as they come up, which that you've got Sejal too. Yeah.
Oh, hi. May I ask about the credentialing for Athena Dow? Is there any cover team represent here? Hello?
Yeah.
Yeah. Ashley and
Yeah.
Carmen Yeah, go ahead, Ashley, if you
Yes.
want to. Yeah.
So you said
we are waiting for credentialing for Athena Dow.
Okay, I can follow up with you offline about that. We do have an email address that you can always send a request to just to obtain an update if it's been a little while. So we can definitely check on that for you offline. I will send you a message so we can connect via email.
Okay, thank you so much.
You're welcome.
Thanks, Ashley. Oh, great. Okay, so Rosanna says, ditto with what Carrie said. You're also doing your best, and it seems to be working, but still assessing and working with billing department to ensure things are running smoothly and making sure we're getting reimbursed. Yes, wonderful.
And that'll show up in your performance metrics as we move along. You know, as the quarters go by, you'll be reporting how many claims you submitted. I didn't ask paid, but you know, I'm assuming once you submit a claim that you'll be paid, and I don't think that's ever been an issue. So just that's tracked through your performance metrics too.
Awesome. Well, you all know where to reach us.
But also, excuse me, that is also a problem because unless we get credential, we won't be paid for the type of services that we're submitting. That's why it is. We were hoping that working with you, it would speed it, you know, like to have within 1 month is what we initially heard. And it's that plus.
Yeah. I wish it was a month, but you know, it's gotten better. You know, I think when CalOptima brought in Verisys to support their credentialing team, it's helpful. It takes time. Right.
Yeah, and I'd like to just say too from CalOptima what I'm hearing, because I'm, you know, definitely this is on my radar every day, every month. And what I am hearing, it continues to improve. So again, if you're having any difficulty, so I mean, I just know because I'm seeing the things come across the desk, just 400 or 500 things at a time coming through. And what I am seeing, again, it seems like they're making significant progress in getting through any of the backlog. So I think any issues that were there for people that did, I am hearing then, you know, that is clearing out or soon to be almost cleared out. And then Verisys talks about, and one of the things is usually, again, from a clean submission, like going forward and what the goal is. Again, as a health plan, we have up to 180 days, just like DHCS, but that's not what we want to strive for, right? Nobody wants to be holding up providers to be credentialing that, no one, right? I was a provider in the past, right? That's not what we're aiming for. We're aiming for as fast as possible, but accurate and making sure we're meeting all the requirements. But that being said, you know, Verisys is saying that, you know, sometimes they're getting things done even in less than 60 days from a clean submission. So when it's possible. I'm not saying that that's going to happen. I'm just saying that I'm hearing good things, that backlog. But, you know, Hoda and Deb in the consultative role now, that will continue after you guys complete the academy. All I can say again is we are here to support you. So if there's any issues that are going on, that maybe it would be best to be funneled through Deborah and Hoda, you know, maybe just from being a participant in the academy. If there's something going on, I would like to be aware of it, myself and Ashley. And that way we, you know, internally, again, we can try to problem solve with Deb, Hoda and your organization to try to figure it out and solve it together. We're here to support you and get your people credentialed as fast as possible.
And it's been so extremely helpful. So we really appreciate that, Carmen.
Yeah.
Really has.
And I know, like, we have some chats here. I mean, the one thing is, though, I don't work that, you know, our credentialing vendor is external, right? So I just want to say this. I think Hoda and Deborah, maybe something's funneling through you. It won't be helpful for me to get emails like long, you know, with lists of employees and things like that, right? That's probably not going to be the most helpful. It will be maybe if there's issues that are going on to bring that to Hoda and Deborah's attention, right? And then if we need to have a quick discussion or if we need to bring in any of our contracting or credentialing folks, you know, that might be a better way to go about it as the clinic group, right? So I'll let you, Deborah and Hoda, take lead on that, but I just want to be respectful to everyone. If I just get long emails and things, and I get like almost 1,000 emails a day. So that's not the best way to go about this because I don't want you to feel that you're not getting listened to.
Yeah, and I will say we have been very cautious on, you know, we email them, but when we hear that somebody's been in credentialing for 6 months or, whatever the timeline is, but Ashley and Carmen has been very helpful helping the responsiveness that we need and in getting them credentialed. So we can follow up with, Sejal actually can follow up with Dr. Bo's team.
Perfect. And I think Ashley, thank you. Put some things in the chat just so people do have the official email. And again, the credentialing updates. The best thing to do is not send duplicate emails so that email box, right? Because we're talking about thousands of providers, right? So the best thing, and I know that they, work to get through that and do that. And then the internal credentialing team takes point in communicating with the external credentialing vendor.
Thank you.
Yep.
Thanks. So I know we're a couple minutes over. These are all things that we mentioned during the presentation today, but for next steps, the one thing that's not on here is feel free to let us know if you didn't already, if you'd be interested on receiving a Kid Builders poster to provide your feedback, and then keep going. You're all doing an amazing job. We're so impressed by you. It's been awesome to work with you. And just remember to keep going from performance metrics. If you need help with that, reach out. And I will be reaching out to the Healthy Step specialist to coordinate a monthly meeting time for them for the Post Academy. And I mentioned about the workflow, and then that resource fair will be coming up in September. So we'll let you know about that in advance. But thank you, everyone. Appreciate your time and congratulations.
Yeah, thank you.
Thank you so much.
Thank you.
Welcome.
Congrats, everyone.
Thank you.
Thank
Yeah,
you.
really.
Great. Okay, take care, everyone. Thank you.
Thank you. Watch
Thanks,
everybody.
Carmen. Thanks, Ashley.
Thanks.
Thank you.
Welcome.
Đáp án nó bị kẹt
Bye.
cái vụ mà